What is orthostatic intolerance in chronic fatigue syndrome? Have you ever felt dizzy or lightheaded when standing up? For many people with chronic fatigue syndrome, this experience is more than just a fleeting moment. Orthostatic intolerance, or OI, is a common and often debilitating symptom of chronic fatigue syndrome, also known as myalgic encephalomyelitis. When someone with chronic fatigue syndrome stands or remains upright, they may notice their symptoms worsen significantly. These symptoms can include lightheadedness, dizziness, fatigue, difficulty concentrating, headaches, heart palpitations, nausea, and even fainting. The root of orthostatic intolerance lies in the body's struggle to properly regulate blood flow and blood pressure when transitioning to an upright position. This issue is often linked to dysfunction in the autonomic nervous system, which controls involuntary bodily functions like heart rate and blood pressure. In chronic fatigue syndrome, the symptoms of orthostatic intolerance can be severe and can greatly add to the overall burden of symptoms that individuals experience. When someone with chronic fatigue syndrome stands up, they may experience inadequate blood flow to the brain, leading to feelings of lightheadedness and impaired cognition. Other neurological symptoms can also occur, such as visual changes and exhaustion. Additionally, peripheral symptoms like cold hands and feet, sweating, nausea, and heart palpitations can arise due to activation of the sympathetic nervous system. There are different patterns of orthostatic intolerance observed in individuals with chronic fatigue syndrome. Some people may only experience symptoms when standing, known as postural orthostatic intolerance, while others may have persistent symptoms even when lying down, referred to as persistent orthostatic intolerance. Interestingly, many individuals with chronic fatigue syndrome report dizziness and lightheadedness even while lying down, which is often overlooked but is crucial for diagnosis. A related condition that can occur alongside orthostatic intolerance is postural orthostatic tachycardia syndrome, or POTS. This condition is characterized by a significant increase in heart rate upon standing. However, it is important to note that not all individuals with chronic fatigue syndrome who experience orthostatic intolerance will have POTS. This indicates that there are multiple underlying mechanisms at play. To assess orthostatic intolerance in chronic fatigue syndrome, healthcare professionals often measure symptom severity while patients are lying down and standing. Tools like the Gracely Box Scale can help evaluate dizziness and lightheadedness. It is also worth mentioning that exercise can exacerbate symptoms of orthostatic intolerance and may lead to transient increases in heart rate for some patients, making management more complex. In summary, orthostatic intolerance in chronic fatigue syndrome is a complex dysfunction of the autonomic nervous system that causes symptoms to worsen when standing or maintaining an upright posture. This condition can significantly affect an individual's quality of life. Proper recognition and assessment of orthostatic intolerance are essential for providing comprehensive care to those with chronic fatigue syndrome. If you or someone you know is experiencing these symptoms, it is important to seek evaluation from healthcare professionals who are knowledgeable about chronic fatigue syndrome and autonomic disorders.